I hope I'm audible and visible. Is it audible and visible? Give me a message if it's audible, visible. I can start the session then. Hello to everyone. Is it visible? Give me a message if it's audible, visible. I can start the session then. Okay, so let's start without any delay. So basically this session is for students who are foundation batch student, means they are in year first, second, third, fourth year except the final year who are giving exam in December, because obviously for you it is a different path. Okay, so today this session is mainly for people who are foundation batch, so who are preparing I think maybe first subject, second subject, so it's basically for them. So that's why anyone who's other than that, I will request them to just join for session which is related to the exam in December. Okay, December exam, I'll take other session. This is mainly for our session of the people giving the exam in this session. Okay, future. So let's start. I'm just checking the filters. Yeah, okay, fine. So basically, if you are giving the exam, that is you are a first to fifth year student, so called foundation batch. So who are going to appear for exam in 2025 onwards. Maybe you are giving the exam in 25, 26, 27. So this is a session basically aimed at that. Okay, clear? So obviously those who are giving for June, I don't think you need to attend. I'll take race sessions for you people starting in May end. Okay, so I'm just finishing my syllabus. So race session for those who are giving exam on 26th of July, that is FMG exam, and 23rd June, that is NEET PG. For that, I will take race sessions starting in May end. For you, we have the race sessions live on YouTube, so you people can rest. This is basically, yes, available and done for foundation batch MBBS students who are just starting their journey towards MBBS, because they have lots of queries that we are not having enough ample inputs, how to prepare, what to study, how to study, because you need to have a very good command over the concept. If you think I will give in the future, NEET will come, next will come, FMG exam or the case, so I will give full discussion about that. Okay, clear? So that is the whole idea. Discussion is related to students who are most likely going to appear for our that session. So basically, I'll guide you and I will take a topic and explain you how to study. So number one we'll discuss is how to study. Number two, what to study, and very important, what not to study. What not, because lots of students who are like not having the guidance, they will randomly get a book or app and start watching it 200 hours of a subject they watch, and then they realize they know nothing. So what not to study, watch, that is also I will discuss what not and what to do, because that is what the idea is. We want everyone to have good chance of understanding. Yes, I said the race will start from end of May, because even if I start now, it will not be suitable. So start at May end. So around 25 May, because we need 1 month to cover. So 25th May, and we'll take it till the NEET PG, and then take super sessions after NEET PG for FMG exam. Okay, yeah, is more than sufficient. Okay, so race sessions are more than sufficient for FMG exam. So let me continue. Let me start. So first is those who are preparing for their exam in the future 25, 26, 27. First thing is, please understand, you are now in a field which is one of the most like hectic field, one of the most tiring field, one field where you need to know 19 subject. You need to know 19 subjects and especially yes 19 subjects. Okay, क्या बात है. Thank you very much, Dr. A. Okay, for passing the exam. I hope you will all be yes getting this. Yeah, yes, I'm reading it. Thank you very much, and I wish you best of luck for your NEET PG in the future. So 19 subject require not just superficial, require deep conceptual understanding, and that is why what I will do is especially the students who are in this session is taking place especially for students who took transfer and you are right now not having any source of study. Let's say some students who are just studying first year, second year, they were in Ukraine, they got transfer, and now they have no idea what to study, when to study. Those classes are also not starting. So that's why, yes, I had this session with lots of, students, plus we are held by some of the, consultants, okay, like Dr. Amrik. Okay, so he, asked to take a session for guiding. So we are very thankful to him, Dr. Amrik. Okay, and will be yes also Dr. Vijay. So they all were asking, okay, let's take a session and help the students. So let's discuss the point. Okay, so first and the foremost thing is I'll take a topic and make you understand how to proceed. Like ECG is something all students should know. Without knowing ECG, you will never ever become a good doctor. Remember, if relatives, don't your relatives send ECG always? हर बार एक ECG भेजते नहीं भेजते? And they ask, tell me, what is this disease? Now they are sometimes just download from internet and send you, or sometimes genuine, and if you don't give the answer, okay, ideally we can block them and never reply to their query, but again it is not possible, so you can't block them. So let's say if you can't block them and you need to give them an answer, how will you give them an answer? That is what this session is all about. If you know ECG, you can reply ki uncle, auntie, didi, jo bhi hai, that there is a yes ST segment change, okay, with T wave inversion. I think you are having a myocardial ischemia. Some of your artery might be blocked, so you urgently get it tested. Maybe you need a cardiac stress test in which they will find out which artery is blocked, how much, and then you might need to do angioplasty. And now, and you please decrease your weight and don't eat too much saturated fat. So now just like, oh, you have become great doctor. You know everything. How you can tell me? I have sometimes chest pain, angina. So that's why now they are so impressed, and that's the day you all are waiting for becoming a great doctor. For that you need to know the basics clear. So that is why the whole idea is get your basics clear. Yeah, clear. So that's the case. Okay. So once again, so I'll start. Okay. So this session. So again, especially students who are studying in Serbia, because that is what the request came. Serbia and West Kazakhstan, and I will myself be visiting it soon. So I will go take session. So we are planning to conduct 19 subjects in these places, face to face and online app. So that is our whole idea. Okay, clear? So once again, okay, thank you to our all the partners for this Excel Education Group. Okay, Dr. Amrik Singh Dhillon for the opportunity for this session, because he is a great guy, also a very helpful person regarding class. I know him since our days in Lugansk, Ukraine. So we had great sessions there. Okay, taking classes since 2010, so almost 14 years back I met him first time and took classes in Lugansk. Now again we are working together and taking classes for students. Okay, also met Plasia Medicos Private Limited, Dr. Vijay Singh Chaudhary. I have even taught him in Uzgrowth. He was one of the students, and I'm very proud he passed and working very well. Okay, Med Education, Dr. Manpreet Singh, and also yes, also yes, HBR Global Meditech Private Limited, Dr. Vikas Nitharwal. Okay, so these are all our yes sponsors for this session. I wish them all thank you very much. So let's continue. Okay, so basically I will teach you how to prepare by teaching your topic, because that's what I believe. Rather than giving so much ज्ञान सब देते रहते हैं ना, too much people giving you ज्ञान and something similar to ज्ञान also they give you. So they are giving you ज्ञान. So we don't want ज्ञान, we want actual knowledge, not this study that study. Okay, so let's continue. I will take a topic called as EEG. It's very similar to ECG, and it is basically electro and cephalography. Now, what is electroencephalography? Okay, what is electroencephalography? Basically, it is a recording of electrical activity of the brain. What is that? Recording of brain electrical activity. Why? We need to study in case of disease. Recording of brain electrical activity. It is for any student who's a medical student and want to learn the topic of sleep and EEG. So that's what I am taking, sleep and EEG. Okay. So we are discussing the recording of brain electrical activity. How? By placing electrodes over the scalp, that is skin of the head. By placing electrodes. Now, first question, how do you know? And remember, it's the investigation of choice in epilepsies, that is seizure disorder. And it is best investigation in our epilepsies and seizure disorders. Okay, sorry for my handwriting. We do give good quality HD quality notes, but right now I'm just writing because I am not in my studio. I am in city of Calicut. I took a offline class. After the class, I'm using my laptop in the center to take this session. Otherwise, we would have got very good audio, video quality, and perfect scenario with good, like soft copy PDF workbook. But right now, I'm just taking a in random sample. Okay. So let's continue. First is the best investigation for this, and who discovered? Hans Berger. So Hans Berger, yes, invented EEG procedure. EEG. Okay. And what he said, that when you put electrodes and record the activity, we get waves. So that's why short brain waves. Brain waves. Now a wave is classified on the basis of the feature it is having. Okay, yeah, thank you very much. PDF I will share, don't worry. All the PDF we will share, this class PDF also previous. So anyone who's giving the exam, one question come from EEG and sleep for sure. So that means any exam you're giving, 100% MCQ will come from this exam. That means if you're giving exam even this session in the June, July or next year or after, EEG will not change. What do you think? If you are giving NEET or next or maybe some USMLE, do you think the topic will change? No. Do you think insulin will become some insulin? No. It will remain, diabetes will remain diabetes, not become phobitis, or after next it will become nextitis. Disease remain the same. Okay, patient will have some of them. Drugs, some will change, but most remain the investigation remains same. EEG never changed since we discovered. That's why concepts remain same. Sometimes minor variations are there, 5-10%. That is. So let's continue. So what we are studying? We are studying our brain activity. So he discovered what? He discovered our, yes, EEG and showed our brain waves. So showed the brain waves. Okay. So next session, when I go back to my studio and we plan proper class, it'll be in HD quality with full, screen, full PDF, everything. Right now, just random session. Okay. So it shows the brain waves. Okay. Now we classify waves by frequency. By frequency. Now, what is frequency? Frequency is basically number of waves per second. Number of waves per second. This is called as our frequency. So once again, what is frequency means? Number of waves per second is called as our frequency. Are you clear? Frequency. Next question. I'll give you example. Let's say this is 1 second and we count the waves. Anyone? How many waves are there? How many waves are there? Count them with me. 1, 2, 3, 4. There are 4 waves per second. So that is 4 hertz. Very good. So it is 4 hertz. Okay. Clear? Thank you very much, Dr. Files, and all of you, because your love and support is very crucial for all the sessions we take. So it is 4 hertz. 4 hertz. Okay. Now tell me what is the frequency of this wave? This one. Count the frequency. Very good. My files is true. Dr. Ma Shedits. Ma Shedits. Hello, Dr. Manoj. So, can you tell me what is the frequency of this wave? What is the frequency? EEG is the easiest investigation. Just need to count the number of waves and you are going to get the diagnosis clear. Can you tell me what is the frequency of this ones? Anyone? Yes, 6 hertz. So now you learn one very simple fact, that is waves are counted in this case. The height is called as amplitude, but that is not the main criteria. Height is called as amplitude, but you can ignore that part because amplitude we don't discuss much. Yes, it is important. I'll tell you later. But right now just focus on the frequency. So the criteria, frequency is the criteria. So the main criteria. So main criteria for wave classification for EEG waves is frequency. Clear? So it is our frequency. Okay? It is our frequency. So without frequency, we cannot know which wave is what. And that is the case. Okay, clear? I'll just show you the physiology workbook that we will use or we have with all the waves just for the sake of completion. And just have a look. See how good our files are, how good we give. I'll just show you. Just have a look. Okay. So this is our medicine workbook which I use for classes. See, it contains everything. It's much easier to understand from here. Okay, let me just open it. So this is a workbook of medicine which I take. See, meningitis with all the features, cobweb formation, type of meningitis, photos, organism, and the student has to fill it up with me and then we revise multiple times. All the signs are there. Very beautiful PDF containing all the findings and we discuss them in the class. This is my notes which I write. What are the cause of seizures? This is seizure disorder we are discussing. These are types of EEG. Here I discuss the type. So that is why right now I'm just taking a introduction. Okay. Once our proper classes start, we take proper classes like absence seizure, patent epilepsy. This is their EEG. How many waves are there? Anyone? What is the frequency in this diagram? Anyone? What is the frequency in this diagram? Anyone? It's a disease called as absence seizure. Can you tell me what is the frequency? There would be, yes, Prabhu, 100% December exam will be there. Next, they have not even yet, got any kind of feedback. 25 they are saying they will conduct. Even that will be tentative because no one is willing to give the next exam. So it is 3 hertz. It is called as 3 hertz spike and a wave pattern. So it's called as 3 hertz pattern. So that's why now you are now diagnosing the disease called as the absence seizure. See, now you become very good in the diagnosis. This is our multiple different kind of epilepsies. So don't worry, I will teach you, make you good in the subject. So one day you are able to learn medicine also, upper motor, lower motor, Babinski sign. But we start with very basic thing, that is physiology from today's session. So let's go back. So frequency is the criteria. Now a person who's awake, awake person has two kind of wave. So awake person EEG. awake person EEG waves. So I'll give the PDF later, don't worry. EEG waves. Right now, I prefer you to write with me or learn with me. So they are either alpha wave or beta wave. Alpha wave or beta wave. Now, what is the difference? Alpha wave is 8 to 13 hertz. Beta wave is 14 to 30 hertz. Okay, so alpha and beta. Okay, alpha. And very soon we'll be starting our offline sessions in multiple places like Kazakhstan, that is West Kazakh University, also Serbia and maybe other places. Just waiting for your cooperation. If you people are there, we'll be happy to come. If no one is there, then obviously online is the mode we are preferring. So remember, alpha is 8 to 13 and beta is 14. So let's make it remember. First is remember beta, okay, beta, okay. So beta is what? Is remember 14 Valentine Day. So remember V Day, Valentine Day. Valentine Day people marry na. If they marry, have something, they can have a beta. So beta कब होता है 14th पे. तो याद करना 14 is V Day is beta. ठीक है. So beta. और नहीं तो बहुत बीट करते हैं कौन बजरंग दल वाले. तो they also beat. So who beat on the Valentine Day? Bajrang Dal, Jindabad, they beat. So remember, 14 is beta, V Day, B Day, V Day, B Day. Okay. Now, what is alpha and what is beta is? So alpha is seen when the person is awake but doing nothing. Doing nothing. That is he's at rest. Aram, alpha, aram. That is at rest. So that is at rest. Relax mind. Relax. Okay. Yeah, soon we'll have the race sessions for FMG and NEET PG exam very soon. Okay. So at rest, relax mind. So which mind? Relax mind is there. Okay. Relax mind. Fine. Chalo. Next question. What is the eyes? If you want your mind to be relaxed, eyes should be open or closed. Question for you. If you want your mind to be relaxed, you should see the things or close the eyes. Close the eyes. Eyes should be closed. So eyes should be closed. So close the eyes. And there should be no disturbance. So that is possible, not possible in India, almost impossible. There is always people who disturb you. Who disturb you the most? Who disturb you the most? Parents, brother, sister, girlfriend, boyfriend, or relative? Who disturb you the most? The relatives disturb the most. Okay, so remember, alpha is aram wave, aram. So aram is 8 to 13. Okay, 8 to 13. Beta is busy mind. So remember, beta is busy mind. So he is now active, busy, thinking mind. So the person is now busy thinking mind. So are you clear? Yeah, relative. Very good. Everyone know relatives. Clear? So relatives like मैं भी चंगा, मेरा ब्रो भी चंगा, मेरी मॉम भी चंगी, सब चंगे. बस ये रिलेटिव ही थोड़े से हरामी होते हैं. चलो. So active, busy, thinking mind. Then eyes open. Like eyes opening. Eyes open. Yes, very soon, Dr. Vishal, session will be there for NEET PG and FMG. Eyes closed, and also there is what? Yes, sensory stimulation. Any sensory stimulation. Any sensory stimulation. Like example, someone eyes are closed and he's taking alpha wave, and you start pinching them or poking them, what happens? Beta wave will come. Like example, a student is taking alpha wave in the class. Suddenly teacher see him taking alpha wave like this. So teacher say, hey, you, get up. And now as he say, hey, you, get up. Suddenly the student open the eye and say, no, sir, I was not sleeping. I was thinking, what a wonderful teacher you are. Sir, what a great class you take. And say, hey, don't do BC with me. Sit down. So that is called as your beta. So beta is what? Beta is our which finding? Beta is when your mind is active. So active mind is which wave? Beta wave. Okay. Now let's discuss the sleep. So sleep also has two stages or the two main stages of sleep. One is light sleep and deep sleep. What does light sleep means? It is easy to wake up. So light is easy to wake up. So what person can be easily woken up? It is our yes, light. Deep is delta. Deep is delta. It's difficult to wake up. Difficult to wake up. So if it is difficult to wake up, it is deep. He's like dead. Remember, he's like dead person. Dead doesn't wake up. Like example, you are traveling somewhere. Okay, as you travel and you are sitting with some Indian. Okay, if you Indian, remember the wave scene and EEG give you delta wave. Which wave? Delta wave. So write down delta wave. And here is theta wave. Theta wave. Frequency is 4 to 7 hertz. Here frequency is 0 to 3 hertz. So let's learn it in my style. So let's say you are traveling somewhere and you have a person. So deep is difficult, delta, da, da. So what is delta? Delta is deep sleep, which is like a dead person. And what is light? Tata, bye bye. So you are saying, I'm so wrong, tata, bye bye. And you start sleeping. So this tata, bye bye sleep is what? Theta. And it is very easy to wake up. So you say, hey, get up. And the person gets up, light. If doesn't wake up, it is our delta wave. Let me give an example, interesting example. Let's say you are going somewhere and you are traveling in a plane and there is someone sitting next to you, and that someone sitting next to you is, let's say, a what he is a type of, let's say, Indian. Okay, so if he's an Indian, most likely he or she is going to talk to you. Why? Indians are very talkative people. Clear? In fact, when a Chinese traveler came, okay, I think his name was Fuyang. Okay, so when he came, he wrote a very good description of India. He traveled almost everywhere, and he said Indians are very talkative. Clear? Even it's written in when Megasthenes came and he wrote this book Indica about India. He came, remember that time, Seleucus Nicator, Chandragupta Maurya. Even he read Indians are very talkative. So Indians love to talk. So if there is someone, yes, thank you, thank you, thank you. Thank you very much for Vishal. Dr. Vishal came. So he or she start talking, and most of the time, most Indian ask is stupid question. There's no limit of their stupid question. क्या पूछते हैं? ऐसे पहला question. Where are you going? Where are you going? This flight is going to Delhi, so I'll be going to Delhi. Or do you think I'll drop in the middle? रास्ते में उतर जाऊंगा, उड़गांव गुड़गांव उड़गांव उतर उड़गांव नहीं ना. So obviously I'll go to Delhi. फिर भी नहीं. Where are you going? Okay. Second question. Okay. What do you earn or how much you earn? Why are you asking how much I earn? Are you some income tax GST officer or you want to know my income? नहीं फालतू की बकवास. How much you earn? चलो ओके हमने बता दिया, ठीक ठीक कमा लिया. Indians are also very smart. They not say I earn this. They say good no बस गुजारा चल जाता है, रोटी मिल जाती है भाई. So they are always giving smart answer. And then are you married? Why are you asking are you married? What the purpose of asking? Are you going to get your are you some kind of matrimonial agent? शादी.com चलाते हो तुम? हाँ, अनुपम मित्तल हो, शादी करा देगा मेरी, क्या बकवास आ रखी है? तो irritating people, okay? And if they ask you, what do? Never tell them you are a doctor. Advice to all the doctors: never tell a patient that you are a doctor. Why? When you say you are a doctor, their inner patient wakes up. Inner patient, and they start asking so many questions. Doctor, when I sleep, I feel very sleepy. When I go to awake, I get this, and they start showing the body parts also. See, look at this. Can you see something is there? Something there, something. Good thing you don't say, doctor, let's come to toilet. I want to get my piles checked. Yeah, I have a treatment also. I carry this stapler gun. Bill aake tera pile theek kar dunga. Irritating. Super. That is why when someone asks me, what do you do? I never tell them I'm a doctor. I lie. I openly lie. I say I'm a librarian. Then they say, librarian? What do you do? I give books to the people to read. You want to read a book? Then you say, no, no, I know. Then shh, silence. And then I get rid of these kind of irritating people. Okay. So that is my yes example. Clear? Thank you, Dr. Shruti. So that is what we should do. Okay. Never tell them. Okay. Now comes the question. Okay. What is the story? Okay. So it is 0, 2, 3 and 4, 2, 7. Okay. Now remember delta is what? Difficult to wake up. Person doesn't wake up easily. It is very difficult to wake up. Now let's do a question testing session and I hope you will be able to answer and we can do it. Should I start? Okay. Let's do it. Okay. So I'll be making the EEGs and I'll be asking. First question would be tell the frequency. Number two, wave and what is the person doing? And what is the person doing? Okay, state of mind. State only Delhi, Gujarat. लिख दो Delhi, Gujarat. ऐसा नहीं. State means sleeping, awake. What? Should I start the question? Are all people ready for me? Okay, let's start. First wave, and all is 1 second. So I'm making you to identify and give diagnosis. So, question for you on your screen, doctors or to be doctors. Tell me. First, frequency, which wave is this and what is the state of the person? Awake, sleeping, light, deep, all. This is how we teach interactive class. We are not like, so the VEG is caused by this wave, alpha is seen in this, then you gauge the beta wave, then this, then this, like reading newspaper. That is what you get in most recorded apps. Just a teacher speaking continuously and you're listening, then you are like, first you're saying, come. This is what happens in video lectures. You are boring lectures where you get. We don't bore. So, okay, very good. 1, 2, 3, 4. It is 4 hertz. Very good. Very, very good. Can you tell me which wave is this? Name of the wave. Very good. Very good. Dr. S. Kishore Kumar. MASH edits. Sachin. Very good. Sachin, very good. Yadav. Dr. Ashok Singh Shirvi. Very good. Dr. Kishore Kumar ने पूरे बता दिया. Yes, theta wave. And can you tell me what is he doing? Is he awake, sleeping? Awake or sleeping? Yeah, he is in light sleep. Can you wake him? Yes. As the chalo, but the moment you say utve, he wakes up. So that is our very good Dr. Chill Vibes, Dr. Vishal Kam, Dr. S. Kya baat hai? Dr. Ronit, very, very good. Congratulations to all of you. Dr. Shankar, very good. All of you can answer, na? Kya kar rahe ho, bhai? If you are here with me, I'm not teaching boring. I don't like boring study. I will myself sleep in a boring class. अपना सेशन होता है जबरदस्त बिंदास इंटरेक्टिव फुल एसी डीसी के साथ मजे लेके पढ़ने का मजा आने का ठीक है चलो ओह क्या बात है डॉक्टर एस वेंचुरा थैंक यू वेरी मच डॉक्टर रविंद्र बिश्नोई वेरी गुड डॉक्टर वाई के यादव वेरी गुड चलो नेक्स्ट क्वेश्चन सो आई थिंक नाउ यू गॉट द आइडिया सो अवर नेक्स्ट क्वेश्चन ऑन योर स्क्रीन सो नेक्स्ट क्वेश्चन next question on your screen identify let's see who give the answer first I'm waiting for the champion of our today's second round and I'll bring chocolates for all of you when I come for offline session dairy milk I always bring thousands of dairy milk my luggage is only dairy milk and I keep giving dairy milk by asking questions by I ask question okay let's see the answers are coming let's say Dr. S, Dr. Sachin, Dr. Ashok, Dr. Sunil, again Sachin, Ravindra, Shankar, Dr. Mahashalit, Shilvai, very good. 1, 2, 2 hertz. Which wave? Delta. Yes, Kishore, Dr. Kishore, very good. It is delta. What is the wave? Person. Deep sleep. Deep sleep. So he is having deep. क्या बात है? Dr. Bisana, very good. Bisna, I think it's Bisna. Okay, sorry. Ronit, Dr. S, Dr. Vikash Kumar, very good. YK Yadav, very good. Perfect, perfect. Let's do other question. That is what the beauty of live interactive class are. I know right now we are not having our full studio facility, which is best audio video quality, but it is also not bad. You can understand what I'm saying. So I'll make the other one. Let's see. Let's say who give the answer first. Very good, Dr. Shankar Ayush. Rock to Pop, YK Yadav, Vikas Kumar. Very good. Perfect. Dr. Harish Kumar. Very good. Very, very good. Clap for all of you. Yes. Anyone? Let's see who give the answer first. Who is the champion? Give the answer. क्या बात है अशोक सिंह सिरवी कॉन्ग्रेचुलेशन फर्स्ट टू आंसर Mashed, I did second. Let's count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very good, Sachin Yadav. Sana, Dr. Sana, very good. Dr. Shankar Ayush, Dr. Facts Culture. Facts Culture. Now, there's no attempt limit. It's just a misconception. Kishore Kumar, Dr. Gifty Selvraj. Very good. Dr. Bisna, Sunil Yadav, very good. It is 10. 10 hertz. Anyone? What is the wave? Yes, Dr. Vikas, Dr. Ravindra Bishnoi, Rock to Pop, very good. Smriti Pandey, kya baat? Sunil Yadav, Ronit, it is, yes, alpha wave. And what the person is doing? What is the person doing? Yes, he's awake, eyes closed. Awake, relax, eye closed. That's the beauty of learning. Once you learn, one day you can see CT MRI and give a diagnosis. Look at the ECG and say, okay, this is having Mandelbrot block, this is acceleration, this is, and say, wow, great, very good. Dr. Vishal Kam, Dr. Ramya, very good. YK Yadav, very good. Dr. Harish, Dr. Shankar Ayush, Mash, very good. Now, next question for you on your screens. Okay. So, screen. Let's see who give the right answer first. So, very good. It is 6. 1, 2, 3, 4, 5, 6. 6. What are the way? Very good, Dr. Therapist. Rock to Ayub. Very good. Very good. This time all are giving. Yes, Dr. Nick Diviti. Okay. Sachin Yadav, Dr. Sana, Dr. Mash Arid, Dr. Nick, Ramya, Therapist, Rock to Bob, Shankar, Sunil Yadav, Vikas Kumar, Sunil Yadav, Sachin again, Smriti, Mash Arid, Ronit, Sunil. Very good. It is, yes, theta. Again theta, na? Again theta. And person is light sleep. Light sleep. That is what the power of learning is. Okay, take one more example. Very good. Dr. Vikas, Y Yadav, Harish. Very good. Let's see one more question. Okay. Anyone? Yes, light sleep. Yes, you are right. Anyone? I'll tell you trick. Very good. It is more than 14. 1, 2, 3. Don't remember. It's more than 14. That is beta wave. No need to count. It is beta. Once it crosses 14, it's beta. मैंने कहा ना 14 के ऊपर बीटा है 14 क्रॉस बीटा it is beta. Very good. If you counted, great people. Great people. No need to count. When you see so many, na, is beta. Okay. No need to count. More than 14 is itself beta. Or the person doing. Person doing. What the person doing? Yes, he is awake, alert, busy. Busy mind. What is doing? Watching EEG lecture. Watching Dr. Ashish EEG class. Easy na? So you all are right now in beta wave. So what is your brain activity? Beta wave. Okay. So you're all beta wave right now. Okay. Clear? Very good. Yes. Eyes are open. Busy mind. See how easy it is? Yes, yes, yes. Very good. So that's what I'm telling you. Okay. The first rule. So I think I will just now explain because lots of people here are for the first time. So they don't have an idea. So the class is basically about idea. I will tomorrow take a session and explain sleep and some other important topic because it's not possible to take any subject in just 1 or 2 hours. It's not possible for that. So I'll just give an idea. My first advice is please be sincere. Understand, you are here to become a doctor. Someone's life will be in your hand one day. So we cannot be complacent. We cannot take for granted. Like you are trying to become, let's say, some other profession. Even if you don't give you 100% effort, you will get a degree and you start working. But here in our profession, we need to be very sincere. We need to have as much knowledge as possible. Number two, all your parents hopes are on you. They trust you. That's why they send you abroad for MBBS. Otherwise, they would have asked you to prepare again or maybe arrange money to get seat here somewhere. But they have hopes that you are going to do well. So don't break their hope, their trust. They love you a lot and they're waiting for you to study, pass the exam and be self-sufficient and independent. अपने पैरों पे खड़ा होना, सक्षम बनना, यही उनका सपना है. उन्हें आपसे कुछ और नहीं चाहिए. So that is why please think about your parents, okay? Think about them. That's the biggest motivation. All my success because of my parents. So think about parents. Number two, we need to have regular study. How? Make a plan, follow it. If you can't make, we will help you. Make a plan, follow it. So need to make a plan and we need to follow. Very good, Dr. Nick. So we need to. Thank you, Dr. Therapist. Okay. Yeah. Okay. So yes, so we have to make a plan and we have to follow it. Okay. Then those who are in year wise, so make a year wise allocation, year wise study plan. Like example, someone who is in first or second year, I will advise them a very simple thing. Okay, do two subjects. What two subjects? Anatomy and anatomy from proper manner, not just watch some 10-20 hour video and say, oh, I am an anatomist. No, you need to do separately what the anatomy of the proper organ systems. Then you need to do what? Bones, embryology, histology, general, all. So you need to do, yes, okay. Don't worry, okay. Forget it, Dr. Ramya. If you be successful, you are going to get everything you want, okay. At the end, it's your success. Hello, Dr. Ash, Dr. Post Medicine. So, medicos, okay. Yeah, medicos. So, anatomy and physiology. Source, okay. You can watch my lectures, my classes at NLC. Okay, so they are live also. You can watch them later also, offline also. So if you are willing, I am willing to come and will take sessions in your university. If you are willing, we'll be there and help you study. Okay, thank you. Yes, क्या बात है, okay. Dr. Nick, thank you to everyone attending the sessions. Okay, yeah. Okay, so one second. So I want everyone to, yes, don't make a mistake. Number 4, start solving MCQ. Start solving MCQs. Again, what are the source? We have very good question bank with 20,000 MCQs. You can use it and solve question and prepare accordingly. Like today, I discussed the question side by side. So need to learn subject and do the questions. Clear? Don't worry, Dr. Sana, just study. Okay. Thank you. Love you, Dr. Shankar from Delhi. And I want everyone to pass the exam. It's my full trust that if you people follow the plan, you're going to pass. Because I've been teaching for almost past 17 years. I start teaching FMGs in 2006 and 7. It's almost 17 years. So I have an ample experience, how know what they want, what they prefer. They want jokes, they want something funny, they want good example, they want good recall, and they prefer to make notes. They don't like just reading printed material. That's why I write and teach them. So I know, start solving MCQs. And number 5 is yes, take care of your health, be positive, and never ever think you are inferior to anyone. Be positive, and you are not inferior. Being a FMG is not a stigma, is not some thappa कि आप inferior हो. So many faculties FMG, आपको पता है? There are almost 1/4 of FM faculties in this sector, NEET, PG, UG, they are FMGs themselves. Okay, so that is a proud thing. Okay, even in apps, Prep, Marrow, okay, An Academy, eGurukul, there are faculties who are FMGs. There are consultants who are FMGs. There are so many professors who are FMGs. So don't worry. Be positive. You are capable of becoming a successful person in the future. Okay, so that is why my advice is simple. Please, 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 just give your full effort, and you are going to do it. Thank you very much for all your. Okay, so that's what I'm telling you. Okay, just ignore. Okay, if you follow your path, it's your life, it'll be successful. आप उनको क्यों देख रहे हो जो गाली देते हैं पत्थर? The same people who throw stones at you one day will be begging for you for help, support, etc. I myself come from a very poor background, but once I become successful, now everyone keeps saying, "Arey, doctor sir, doctor sir, doctor sir." Why? Because I have now enough money, power, prestige. I can do things. One message, I can get job, like placement. So that's what I'm telling you. Be positive. Future is going to good if you work hard now. Future will be great. Someone said, what is the best time to plant a tree? किसने पूछा सबसे बढ़िया टाइम क्या है ट्री लगाने का? आंसर है 5 year back, 5 साल पहले लगाना था. तो टुडे मैंगो वुड बी देयर. Second best time is now. So therefore, don't waste time. Start studying now, and that is the simple concept. See, for NEET PG new pattern, start practicing. Already we have started our new pattern 50-50 question. So our tomorrow we are having a test which is 50-50 parts. That is 50 question, 50 question, 50 question, 50 minutes. So we are already implementing the pattern as per the exam. Okay, chal. So I will wrap up the session because it's almost 10 o'clock and I just finished my class. So I am just coming after my class. I have to go back to hotel, eat something, sleep, and be ready to come tomorrow. So anything you can just message any of the team members. So I'm just writing the Telegram number. Please message on Telegram, not WhatsApp. WhatsApp already relatives eating your brain. That's why I don't open WhatsApp. Okay, if I open also, I keep like not see. So Telegram 777-000-5046, and there's also a wonderful Telegram group with 40,000 FMG students who are getting all the notes, PDF, summaries, flashcard. They're very beautiful. Okay, so thank you very much, Dr. Nick. Okay, yeah. So yeah, thank you very much. Okay. I am for physio and medicine, and we have very good faculties for all other subject. You attend their session and you will be their fan. Okay, clear? Very great faculties. Okay, so name etc. I can give the list. They are wonderful teacher and they all have ample experience. Okay, clear? Offline GT tomorrow we are having a online. Maggie will be posting that very soon, but tomorrow we are having a offline GT and very soon we'll be there. Okay, yeah. Yeah, class is over because I know there are so many students. First time they are sitting for some session. Okay. Otherwise, they open the app and they sleep. How much you can watch a app recorded lecture? I don't think more than 5 minutes if you are starting for the first time. If there's an exam tomorrow, maybe all night. But if there's no exam, even we all do the same. कोई ऐसा तो ना आप लोग special. Tomorrow also we'll do 9 p.m. and I'll teach you about sleep. Okay, and our other topic like active passive transport, some topic of general physiology will be discussing. So we'll be starting with general. Okay, and I am planning to take full long 5-6 day class for you people very soon in West Kazakhstan and also Serbia, and if allowed other place also. देखते हैं. Already have taken classes in multiple places. Let's hope we get a class very soon. Okay. So all once again thanks to Amrik Bhai ji for this session, and especially the students who are coming here to attend. Okay. Also Vijay. Okay, Dr. Vijay. So thank you very much once again. 9 o'clock we'll have. Okay. Yeah. I'll take, see, all subject will take. Don't worry. Okay. Clear? Oh, Risha, very sad for that. Okay. Don't worry. Okay. Be positive. We'll do something great. Okay. Just study. Okay. If you want lecture note, etc., message me. I'll try to help you by arranging some classes. You can watch them and give the exam. But be positive. Study is the main thing. Okay. First prof. Okay. Only one thing. And not me. If you want to do live class of anatomy, our anatomy class is starting from 20th of May, live class. But you can watch a recorded lecture anytime, 20th May, live class by Dr. Ankit Khandelwal, very great faculty, okay, and he's on an academy, Alan, and so many other platforms. So you can attend the class live from 20th May. It'll be daily 5-6 hours for 7-8 days, okay. So 20th May anatomy class, okay. Fine, Rishabh. Rest you can message me. I'll update you, okay. Physio I'll be taking later on, so it's all up to you. My request is please don't waste time. The biggest thing is wasting time is the biggest thing, okay. Chalo. So take care. 9 p.m. we meet tomorrow. 9 p.m. चलो टेक केयर बाय बाय हैव फूड अच्छे से खाना ठीक है च्यू प्रॉपर्ली swallow properly and sleep properly okay and yes if you get time to enjoy you can enjoy tomorrow I don't mind okay I will free you so that you can have good enjoyment also वैसे enjoy करते ही क्या हो है ना except what maybe doing some fun otherwise it's difficult चलो take care bye bye spokojnie noci okay good night okay. Any other doubt, you can message me. I will be there with you people. Okay. Anything else? No. Okay. Chalo. Good night. So everyone, good night. Yeah. Don't worry. We'll take that concise session. Dr. T.M. Ashkar. Don't worry. Okay. So just see, we have everything. Okay. We have every possible thing. We have medicine paper. We have physio paper. We have surgery. Everything. Okay. Don't worry. Trust me, we have everything possible with us. Okay. So I have not taken anything other than this class today because I just wanted to inform you about class. And once again, thank you very much to all our, yes, esteemed team partners. Okay. And our, management things. Thank you very much to all. Okay. So once again, I will just thanks. Okay. Yes, for this classes. Thank you once again to everyone for joining and coming. Okay. Yes. So thank you very much. Take care. Bye bye. Good night. Good night. Good night. Bye bye. Classes, we are taking 5 days. Okay. 5 days classes. Okay. 5 days. Okay. Chalo. Take care. Good night. Bye bye. Okay. Sunil. Bye bye.